Top world news. Angela Merkel says hard evidence she was target of Russian hackers. German Chancellor Angela Merkel has cited hard evidence that she was the target of Russian hacking. Der Spiegel magazine reported last week that Russia's GRU military intelligence service appeared to have got hold of many emails from Merkel's constituency office in a 2015 hack attack on Germany's parliament. Moscow has denied previous allegations of hacking abroad. Ms. Merkel said she will keep trying to improve ties with Russia, but admitted the hacking attack did not make Germany's efforts any easier. Trudeau says world has questions particularly for China on COVID-19 origin. Prime Minister Justin Trudeau says there will be questions particularly for China about how the coronavirus pandemic began and its handling of the early days of the crisis. His comments to journalists during a daily press briefing come on the heels of a new Angus Reid poll that finds an overwhelming majority of Canadians do not believe China has been transparent about its handling of the pandemic and do not want closer ties with the country. However, the Trudeau government has been criticized for staying largely tight-lipped even as countries like Australia began to demand an inquiry into China's efforts to hide the early spread. It has accused countries like New Zealand and the US of violating its One China policy over their calls for Taiwan to be included in the meeting of the World Health Organization's decision-making body. For-profit nursing homes have 4 times as many COVID-19 deaths as city-run homes, Ontario, Canada, Toronto Star. Residents of for-profit nursing homes in Ontario are far more likely to be infected with COVID-19 and die than those who live in non-profit and municipally run homes, the Star has found. A Star analysis of public data on long-term care homes shows the facilities have been hit by outbreaks at approximately the same rate, regardless of ownership. In homes with an outbreak, residents in for-profit facilities are about twice as likely to catch COVID-19 and die than residents in non-profits, and about 4 times as likely to become infected and die from the virus as those in a municipal home. Stewart said that, based on the experiences of the union's members, for-profit nursing homes use more part-time and casual staff and have lower staffing levels overall compared to non-profit homes. 60% of coronavirus patient deaths not counted toward official total, Moscow officials say. Over 60% of deaths occurred from obvious alternate causes, such as vascular accidents, stage 4 malignant diseases, leukemia, systemic diseases linked to organ failure and other incurable deadly diseases, Moscow's health department said in a statement. Moscow reported 639 deaths directly caused by COVID-19 in April, meaning about 1,597 coronavirus-positive patients died that month overall, based on the health department's percentage. North Korea leader Kim Jong Un missing for another 12 days. North Korean leader Kim Jong Un has been missing for another 12 days, leaving US intelligence only able to guess this week that he is probably alive and well. The Hermit Kingdom released photos of its dictator at a Red Ribbon event on May 1st to quash escalating rumors that his 3-week absence was a sign that he was dying or even dead. But he has not been seen since, making it a dozen days and counting from the release of the images, which US intelligence has been unable to verify. However, he conceded that intelligence can't say one way or the other whether the recent open source photos of Kim were real. Top technology news. Mitch McConnell is pushing the Senate to pass a law that would let the FBI collect Americans' web browsing history without a warrant. An amendment proposed by McConnell would, for the first time ever, let the FBI collect records on Americans' web browsing and search histories without a warrant. A bipartisan group of senators proposed a measure to block the FBI from accessing people's web browsing history without a warrant, but it failed by 1 vote on Wednesday. Trump administration approves largest US solar project ever. The US Department of the Interior approved this week the biggest solar project in the United States ever, an estimated $1 billion solar plus battery storage project in Nevada. The Senate just voted to let the government keep surveilling your online life without a warrant. In the middle of this, and with this shift in mind, The Senate voted on Wednesday not to protect Americans' internet browsing and search history data from secret and warrantless surveillance by law enforcement. The vote was for an amendment to the controversial Patriot Act, which would have expressly forbidden internet browsing and history from what the government is allowed to collect through the approval of a secret court. There is little information that is more personal than your web browsing history, Senator Ron Wyden, a Democrat who sponsored the amendment, told Recode. This part of the law allowed the government to simply get an order from a secret court established by the Foreign Intelligence Surveillance Act, FISA. Ohio has stopped kicking workers off unemployment after a hacker targeted its website. Top science news. Scientists have yielded evidence that medieval longbow arrows created similar wounds to modern-day gunshot wounds and were capable of penetrating through long bones. Arrows may have been deliberately fletched to spin clockwise as they hit their victims. A recent paper published in the Antiquaries Journal by a team of archaeologists at the University of Exeter in the UK has yielded evidence that longbow arrows created similar wounds to modern-day gunshot wounds and were capable of penetrating through long bones. The University of Exeter's Oliver Creighton, who led the latest study, and his co-authors argue that such experiments are typically done over shorter ranges, so the arrows are not fully stable and spinning in flight. It's relatively rare to find direct evidence of violent trauma from weapons to skeletal remains in medieval burial sites, with the exception of mass burials from known historical battles. Per the authors, data from these sites has yielded useful information on the realities of medieval warfare, how people fought and were killed, which weapons were used, and what sorts of injuries these caused, and what armor, if any, was worn. Evidence of trauma specifically caused by arrowheads is even rarer. An analysis of millions of Facebook pages during the 2019 measles outbreak revealed that anti-vaccination groups are better positioned to access undecided people than public health authorities are. Researchers worry similar factors could sow distrust of science during the coronavirus pandemic. Analysis of millions of Facebook pages during the 2019 measles outbreak revealed that groups promoting distrust of science, like anti-vaccination groups, are better positioned to access undecided people than public health authorities are. The Center of the Universe Johnson study provides a map of how anti-vaxxer groups, technically called clusters, reach undecided people on Facebook. You can think of one individual Facebook page, like the homepage of a group, as a cluster of people. The blue are public health messengers like the Gates Foundation who promote science and vaccines. New study finds that about 90% of gamers aren't actually addicted to video games. Results show that there is still a significant minority, though, who can become addicted and suffer mentally, socially, and behaviorally. A recent 6-year study, the longest study ever done on video game addiction, found that about 90% of gamers do not play in a way that is harmful or causes negative long-term consequences. The aim of this particular study is to look at the longer-term impact of having a particular relationship with video games and what it does to a person over time, said Sarah Coyne, a professor of family life at BYU and lead author of the research. To measure predictors and outcomes to video game addiction, Coyne and other researchers studied 385 adolescents as they transitioned into adulthood. Two main predictors for video game addiction were found, being male and having low levels of prosocial behavior. Speech droplets generated by asymptomatic carriers COVID-19 are increasingly considered to be a likely mode of disease transmission. Speech droplets generated by asymptomatic carriers of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, are increasingly considered to be a likely mode of disease transmission. Highly sensitive laser light scattering observations have revealed that loud speech can emit thousands of oral fluid droplets per second. In a closed, stagnant air environment, they disappear from the window of view with time constants in the range of 8 to 14 minutes, which corresponds to droplet nuclei of circa. High viral loads of severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, have been detected in oral fluids of coronavirus disease 2019, COVID-19, positive patients, including asymptomatic ones. A rare, Kawasaki-like disease is striking kids who have coronavirus antibodies, a Lancet study from Italy shows. Doctors in 15 US states are reporting that at least 164 children have fallen sick with a rare inflammatory illness similar to a condition known as Kawasaki disease. New York State has reported 102 cases of the pediatric inflammatory syndrome so far, with 29% of the cases involving children between the ages of 5 and 9 and 28% between the ages of 10 and 14. A new peer-reviewed study out of Italy, published Wednesday in The Lancet, details the cases of 10 children who presented with this condition during the COVID-19 outbreak there. Our study provides the first clear evidence of a link between SARS-CoV-2 infection and this inflammatory condition, and we hope it will help doctors around the world as we try to get to grips with this unknown virus, said Lorenzo Dantiga, lead author of the study from the Hospital Papa Giovanni 23 in Bergamo, Italy, in a statement. News sources are in the descriptions. Subscribe for daily news content. Thanks for watching.